Hi everyone, it's Erica. Hello.
Morning.
Okay. Can you hear me? Yeah. Okay. Well, thanks for joining today. We're discussing the Community Tech pilot program. It's officially known as Advancing Community Pharmacy Quality, a Wisconsin statewide research pilot project. So this morning I emailed everyone the PowerPoint so you're able to print it and follow along, but it's also on GoToMeeting here. So if you want to also log into your computers. But if you can't get onto the computer, I'm going to talk through the PowerPoint as well, so you should be able to follow along. If you want to just take a moment here to mute your phones, then we can get going and everyone can hear clearly. And then at the end of the PowerPoint, we'll open the floor to discussion and questions.
Good morning, everyone. This is Sarah Sorum at PSW. I'm pleased to be joining Erica for this call. We're excited to really move into the next phase here. Many of you have been following along the journey this whole year of 2016. It's hard to believe it's September already. And we're excited to have Erica onboarded here about a month into her role and really ready to hit the ground running. So we'll look forward to the discussion at the end of today's call.
Okay, we'll get started here. So during today's phone call, we'll go over the Tech background, the eligibility requirements for pharmacies, pharmacists, and technicians to participate in the program, an update on the training materials, an example of the workflow, validation and quality assurance requirements, the study design, the timeline, and then we'll end with open discussion and questions. First, I'll tell you a little bit about myself. My name is Erica Martin. I joined PSW about a month ago to focus on the Community Tech pilot program. Before coming to PSW, I worked on policy and programs at the Department of Children, Families, and the State Senate. My interest in pharmacy comes from my work at a community pharmacy in Sun Prairie, where my sister also works, and she's also a student at UW School of Pharmacy. So she threw my name in the hat when a position opened up, and it kind of hooked me on, and I've been interested in pharmacy ever since. So working on this project here is kind of the perfect combination of my experiences with program development and pharmacy. Going forward, I'll work with all of you on site-specific training and supporting your pharmacists, technicians, and management. I also manage the project details, coordinate the study activities, and chair the regular team meetings. So also joining PSW on developing this project is the Practice Advancement Leadership Team and also Lauren Putterman. The leadership team is a group of administrative residents throughout the state that are working on technician-focused projects throughout the year. We have a smaller team dedicated solely to community pharmacy Tech. The team is comprised of Dan Shankett, Javon Oliver, Alyssa Billmeyer, Nick Capote, and Landon Cortman. And part of that group is on the phone call with us today. Also on the phone is Lauren Putterman, a community pharmacy resident at Aurora. Lauren has been a huge help developing the pilot proposal during a rotation she did here at PSW. We don't want to lose Lauren's leadership, so she's staying with us even after graduating and now into her residency. So I think this is a great team here. We've been working together on developing the tools and the trainings for the pilot. Additionally, we've discussed some small but effective workflow changes that a pharmacy could make to free up a technician. Another area we're talking about is direct patient care services that can be provided without hampering the pharmacy with additional trainings and workflow changes. So as we all know, TCT is allowing eligible, trained, and verified technicians to provide final verification of a technician-prepared medication versus final verification by a pharmacist. There's a lot of evidence that technicians are also just as accurate as pharmacists at completing final checks. And by having technicians complete the final checks, pharmacists will have more time to provide clinical services. The goal of our pilot here in Wisconsin is to implement programs in 15 to 20 independent chain or health system community pharmacy practices across the state. The pilot will be studied by Concordia University, Wisconsin to assess the impact on patient safety measures by comparing pharmacist and technician accuracy. If the accuracies are significantly similar, the program will be deemed safe. The study will also examine how a pharmacist's time was reallocated towards patient care services after implementing TCT. So we're basing our pilot off of our neighbors in Iowa, and this is considered brand new territory throughout the country. Iowa is the first, and Wisconsin will be the second state to expand TCT and community pharmacies via pilot programs. So as you can see from the graph, after 18 months, pharmacists spent less time on dispensing and more time on patient care and practice development due to TCT. So what does it take to participate in the program? Well, pharmacies must be an independent chain or health system community pharmacy located and licensed in Wisconsin. They must be a WPQC accredited pharmacy. Pharmacies must appoint one supervising pharmacist at each site to oversee the operations and outcomes of the program. Pharmacies will utilize technicians that meet criteria outlined in the pilot program. And this was a slight change from the presentation you were emailed this morning. So we'll go over the criteria in a bit here. Continuing on, pharmacies must support the completion of pharmacy staff training. Pharmacies must also comply with the TCT accuracy validation requirements. Must have a pharmacist physically located on the premises while TCT is being performed, and the pharmacist must be positioned in a way to enable direct patient interaction, and the staffing in the pharmacy must always be adequate. Pharmacists must perform all prescription, transcription, accuracy checks, and clinical reviews. Compounded medications, reconstituted medications, mailed or delivered prescriptions, and prescriptions that require technology overrides will be excluded from the TCT workflow. Pharmacies must utilize technology to support dispensing activities. For example, this would be barcode scanners. Pharmacists will continue to perform patient consultations as required by state law. And pharmacies will implement and follow a quality assurance protocol and process and comply with research pilot project deliverables and reporting requirements. So these reporting requirements will be completed by the supervising pharmacist.
I just want to take a brief pause and provide a little bit of commentary on the pharmacy requirements that Erica just reviewed. We have, as you all know, gone through an evolution of determining exactly the content for the proposal. Some of these pharmacy eligibility requirements are the exact same as what you saw earlier this year when we had our last webinar, and some have evolved a bit. And we provided a proposal to the Pharmacy Examining Board in May, and all of you provided letters of support to help us with that proposal. As you know from that discussion, the board provided sort of the assurance and the go-ahead to move forward with further fleshing out the pilot requirements and details for setting us up for full approval, which Erica will review our timeline on that. But in the process of going back through the proposal and having some offline discussions with Pharmacy Examining Board members and some of you, we've further tweaked the pharmacy eligibility requirements as well as further tweaked some of the other requirements that Erica is going to review throughout this slide set. So some of them are going to look very, very similar to what you've seen previously, and some are going to look, some aspects of the program are going to look a little different. And all of that is very purposeful and was done with a great deal of feedback to maximize our chances of success in getting full approval from the Pharmacy Examining Board. So we can, during the discussion portion, go back through and address questions about changes that may be new information that you're seeing. But I just wanted to sort of set the stage for why some of this might be looking exactly the same and some of it may look a little different.
Okay. So if you find your sites that meet all those requirements and decide to establish a program at those sites, next question is, how do you pick which technician should participate in the program? So a technician should meet the eligibility requirements to become a TCT validated pharmacy technician, which is also known as a VPT. They must complete didactic and practical training, which includes passing an exam. And then after completing this training, the VPT candidate must be initially validated. So to be eligible, a VPT must be age 18 or older, have an employment status of greater than or equal to 0.5 full-time equivalent at the pilot pharmacy, have a minimum of 2,000 hours of experience as a pharmacy technician, or completion of an accredited technician training program and at least 6 months of employment at the pilot pharmacy. You must complete didactic and practical training related to TCT, must demonstrate and maintain accuracy throughout the pilot program, which means greater or equal to 99.8% accuracy. And then they must also adhere to the pilot program reporting requirements. So the training and tools are being developed right now by PSW, the leadership team, and Lauren. The training will be uploaded on PSW's website, and it's going to look very similar to WPQC's home study, which you've all taken as WPQC pharmacies. So at the end of the online training, an exam will be given to each VPT candidate to take. And if they pass the exam, you'll be able to print your certificate of completion that'll include the date, and then you can keep that for your records. The online training will be completed first, and then the practical training in the pharmacy will follow. So the topics for the training will include elements of a package label, is the drug name, dose, dosage form, control or lot number, and expiration date. We'll have the medication and pharmacy abbreviations needed to match the order medication with dispensed medication. Have common dispensing medication errors and concepts, such as wrong medication, wrong dose, wrong dosage form, and a few others. The training will also have organizational policies and procedures on reporting of medication errors. It'll have an overview of the organization's medication use process, which includes procurement and ordering, dispensing, administration, and monitoring. And then to end with a practical training designed to assess the competency of the technician prior to starting the validation process.
So if we could just pause related to training. So this is an area where we've spent some time fleshing this out further. On our last call, we did not have this level of detail yet determined. So we determined the training curriculum based upon the experience in Iowa, as well as the elements of the inpatient tech training that sites do for inpatient tech. And we also received feedback from several of you, as well as from the Pharmacy Examining Board members, in terms of what was important for them to see technicians trained on. So as Erica mentioned, PSW will coordinate all of the legwork in building the training curriculum. Just to clarify, it won't be the same content as the WPQC training, but will be the same format where it's easy to access online, and as Erica said, you'll be able to, as the supervising pharmacist, see that your technician successfully completed the training modules. And all of the training is designed, as you can probably see from the curriculum, to empower the technician to really address patient safety issues, understand the importance of the work they're doing in product verification, to set the stage for really quality tech. So we can discuss this further as well, but as Erica mentioned, this is currently in development. We're going to be leveraging a team of residents to help us with the work in putting this together. We may call upon some of you to be speakers for the programming. That's a little bit yet to be determined, but we'll have basically an online training module.
Right, so once the training is complete, a VPT candidate will be validated. So to do this validation, a VPT candidate completes 1,000 final checks over a minimum of 5 separate days. A pharmacist will then audit 100% of the final checks for accuracy. And then the VPT candidate must meet 99.8% accuracy in order to be validated. And we're developing tools right now so this information can be recorded efficiently and easily so you can keep it for your records and it won't take too much of your day away to do so.
So the validated pharmacy technician requirements are, this is another area of change, I would say, since the last time you all saw the proposal. Again, this is based largely on Wisconsin's inpatient tech model and was something that was communicated by the Pharmacy Examining Board as pretty clearly a requirement for them to feel comfortable with the program. So again, this is going to look different than Iowa's program. This is a different process. It builds upon the Wisconsin inpatient tech model.
So to have a successful TCT program, the workflow will need to be readjusted at each site. We'll work together to make small changes to your workflow that will have big effects. First, we'll have to find a way to shuffle the VPT candidates' duties to other staff members to maximize according to each person's strengths. So this will be an adjustment for everyone at the site, but we'll need everyone on board for effective practice change. In Iowa, they found it that all pharmacy team meetings to explain this practice change helped the transition quite a bit. So the dispensing process will also change in order to carry out TCT. Just as a reminder, the workflows will be customized to each pharmacy. And a prescription will come in to be filled, and then it'll be sent to the processing station. Is the prescription compounded, reconstituted, mailed, or delivered? If the answer is no, then the prescription can be sent through the TCT process. The prescription is then filled and sent to the checking station. Were any technology overrides required when filling? If the answer is yes, then the prescription should be sent through the traditional workflow. But if it's no, then it can continue on through the TCT process. The prescription is filled and sent to the checking station for the VPT to overlook. If the VPT has a question during the final check, they will send then the prescription to the pharmacist to be checked. If the VPT approves of the prescription, it can be sent on to the pickup window. So during this entire process, pharmacists will still complete drug utilization reviews, and a pharmacist will do a show and tell or other consultation before delivering the prescription at the pickup counter. Another layer of this process that's not included in the workflow that I just had up on the screen is a quality assurance measure. So each pilot is required to check a minimum of 5% of all TCT final checks per validated pharmacy technician, and they'll be audited by a licensed pharmacist each day that TCT is performed. So just to reiterate that here, every day that TCT is performed, 5% of all checks per validated pharmacy technician will need to be audited by a licensed pharmacist. And then when this auditing happens, a VPT must maintain 99.8% accuracy to continue serving as a validated pharmacy technician. So this accuracy will be assessed quarterly by the supervising pharmacist. And we're developing a log that'll make it easy to record this data on a daily basis, and it'll pre-calculate the accuracy for you so you don't have to worry about crunching numbers when you have, are busy throughout the day. So some data that will be recorded on this log will include the total number of final checks performed by the VPT, the number of final checks that are audited, the percentage of final checks that are audited, the number of errors identified, and the type of error such as wrong drug, wrong dose, wrong dosage form, or incorrect quantity. So the supervising pharmacist will submit aggregate data for each site to a Qualtrics survey on a monthly basis, and then this information is going to be studied by Concordia University, Wisconsin. So speaking of the study, before we can get going with Tech, we'll have to establish a baseline. So the baseline will be used to compare pharmacists' accuracy to that of validated pharmacy technicians. We'll measure this baseline by taking 50 prescriptions for 15 consecutive days that are filled by a technician checked by a pharmacist, and then double checked by a second pharmacist. That'll establish the pharmacist's accuracy. And then the second baseline that'll be established is pharmacists who will be affected by TCT will record the time they spend on dispensing, management, practice development, patient care, or other activities for those 15 days. And then that'll later be compared to how time was reallocated after TCT was implemented. So how long is this pilot project going to run? The setup stages and educational materials are being developed now, and the Pharmacy Examining Board is reviewing the proposal at their meeting on September 22nd. We're hoping to have it approved on the 22nd and move forward with training. We hope to complete the training by the end of the year and start TCT in your pharmacies at the beginning of 2017. So the study of the program will last 1 year once they get kicked off in the pharmacies. However, pharmacies will be able to participate in the program for 3 years, which is allowed by the law that initiated this pilot. And so you can participate until the Pharmacy Examining Board directs otherwise. The pilot expires after 3 years, or until rules are promulgated that change, the process. For our next meeting, which is in person here at PSW on October 26th, I have a tentative agenda developed right now. So we'll go over the training materials that'll be developed, the study of the program, and then the reporting requirements, along with any tools that have been developed. What I need before our next meeting, I need some help from you. So by Friday, October 14th, if you could select 1 or 2 sites that you would like to implement TCT in, could you send me the contact information for each site and the name of the supervising pharmacist at that site? Additionally, I'd like to visit everybody and get to meet everyone face-to-face. So if you could send 3 to 4 possible dates sometime in September or October that I could come by just for a short period of time to introduce myself, the sooner the better would be great for those, so I can introduce myself. My email address is emartin@pswi.org. Additionally, outside of this, we'll start brainstorming ways to make small changes at each site's workflow, so you'll be able to have a technician open to do these final checks. And you may also want to hold an all-pharmacy meeting to get all hands on deck before the training start and the program starts. So we'll start. The final thing is we're going to send out a template that has the policy on it, and you can start developing policies for each specific site. The policy that we've designed as a template has the requirements according to the proposal, but you're more than welcome to make additional requirements for each site. So with that, we can open it up to anyone's questions or comments, anything you'd like to share.
Hey, Erica, before we move to participant questions, I'll just make a couple more comments. Erica's done a phenomenal job getting onboarded in the last, really it's been more like 3 weeks. We consider we've had the annual meeting since Erica started, and we definitely are still looking for feedback and further definition in certain areas. So as you digest the material from today's call, or as you review the material that Erica's been sending out, we want this to be a program that's designed for all of you, for those that are participating. So there'll be some things that we have the capability to make some adjustments on, and there will be some things that we don't because they're included as requirements in the pilot. But we've built it in such a way that we're trying to be as enabling as possible so that best practices could be showcased, so that tweaks dependent upon your workflow could be adjusted. So that'll be really important for us to communicate and decipher and further fine-tune, and can be things that are done sort of beyond the Pharmacy Examining Board approval. We have not received final approval from the Pharmacy Examining Board on this yet. We, as Erica mentioned, expect to receive that on September 22nd. We'll obviously keep all of you in the loop on that. So I certainly would understand that you may not want to go full bore in working through all the details of this until we get that final approval on the 22nd. So we're trying to fast track this as much as possible, but also want this to work with your timelines within your organizations, implementing of other programs. So we can just have two-way dialogue about that, and you know, we're pretty willing to work with you, I guess is what I'm trying to say. And Erica's going to be a phenomenal resource as we move forward. So with that, I just wanted to make those couple other comments, and we can open it up to questions.
Hey, Erica, and Joe from UW. I just had a question on the validation of technicians and how that might happen. Because I know that we're going to be excluding mail service prescriptions, but our mail service pharmacy is probably our highest volume. Would it be within the scope of the pilot or what we're doing if we have some smaller sites that we're thinking about doing this with, but for the sake of validation, we could probably, you know, knock that out within the 5-day window at one of our busier sites. But for some of our smaller sites, it might be more challenging and take weeks or up to a month to do that. Would it be reasonable to have a validated technician go through that validation at a higher volume site that's maybe not going to be the site that Tech is ultimately done at? Or does that have to be done at the site where the supervising pharmacist will be and that program will be set up?
That's a great question. I don't believe there's any requirements in the proposal now that state that the supervising pharmacist must be the one validating or that it must be at the pilot site. So we could possibly work if they're willing to go to another site to get validated if it's quicker to do so, because it's just any licensed pharmacist can do the validating of any VPT candidate that's completed all the training.
Yeah, I think you just probably want to make sure that the workflow is the same or similar. So, you know, obviously you're within the same system, so you're using the same technology and all of that. So I think that would probably be important. But we can make sure that the language, the way it's written, would allow for that, because I could see where that would be really a nice efficiency.
Perfect. Thank you.
This is Nicole Zengel with Malot's Home Care Pharmacy. We do the majority of our medications via delivery, either to patients in their own homes or patients in skilled nursing facilities. So it sounds like, based on the exclusion of products being delivered, that long-term care pharmacies in general will be excluded from the community pilot. Would we fall under the institutional pilot then?
Well, that's a great question. I would look at the form that the Pharmacy Examining Board has created for. I think they've branded it institutional tech now is the new terminology. Is that right, Erica?
Mm-hmm.
So there was an email sent out to all license holders. I want to say early August, that had the link to the forms, or you can find them from the Pharmacy Examining Board webpage, that has the institutional tech outline of what that quote-unquote pilot looks like now.
Mm-hmm.
From my recollection, it may have broad enough allowances that it could potentially work for long-term care. I don't know that for certain. I'd be interested in your feedback on that.
The institutional requirement does include a provision that the medications must be administered by someone who is authorized to administer medications within the facility, but it's potentially broad enough that it could allow for med techs to administer them. So I'm just trying to figure out if, you know, us being kind of a niche practice, we're being unintentionally excluded.
Well, I wouldn't say it's there has been dialogue with the Pharmacy Examining Board about tech for long-term care, and I think the Pharmacy Examining Board's discussion around that was hopeful that long-term care pharmacies could fall under the institutional tech pilot. We've been told that although existing variance holders had to submit their pilot proposal or their pilot application by September 5th, that there's still going to be a rolling admission process to that. So if you're interested in coming on board with institutional tech, they're still accepting ongoing sort of rolling admissions for that. I would say it has been our understanding that the Pharmacy Examining Board members were leery of the delivery piece, and because there's not the, in the traditional sense of community pharmacy, there's not like a licensed or other authorized, if you will, individual administering the medications, that there was a differentiating factor there between community and institutional. So based upon what you're describing and based upon what I know of the Pharmacy Examining Board discussion, it seems like it may be a better fit to go through the institutional model for the Molat's long-term care location.
All right, thank you, Sarah.
And we can talk offline more about that too. Be very interested in your ongoing feedback about that.
Let's plan on doing that.
Hey, Sarah, Erica, this is Ken from Shopco. So still under the statutes under pharmacy practice, the pharmacist to tech ratio is 4:1. How is this going to affect that ratio? Will this person be included in that 4:1 ratio?
Yes, it would be still included in the 4:1 ratio. There's another, just like there's the institutional tech pilot, quote unquote pilot application, there's a ongoing rolling application for changes to the technician ratio. There's there were previously variances for that, and now there's a quote unquote pilot running that the Pharmacy Examining Board has for ratio of technicians to pharmacists, but I would say that it's very unlikely that they would allow a site to have two pilots going at once. I don't know that for certain, but so it would be my understanding that the Pharmacy Examining Board would expect that even with the community tech pilot that you'd have to maintain the 4:1 ratio.
Okay.
Hey guys, Tony, you may have covered this, and I apologize because Brendan was on the earlier calls, but he has since moved on. So if you cover this, I apologize again. But how often do the technicians have to go through the auditing and validation process, or is it a one-time deal where they do it once and they get that certificate and they're certified, or is this like a yearly thing that they have to go through and make sure that they're staying within that tolerance?
So it's just the one initial validation where you have to meet 99.8% accuracy, and then we're going to develop a tool where it is every day the 5% audits that take place. So that'll be maintaining that 99.8% over time, which will be assessed quarterly by the supervising pharmacist. So if a validated pharmacy technician does not maintain 99.8% accuracy over a quarter, then they would redo the validation process.
Perfect, thank you.
Is there anything that, for some of you who have are either seeing some of these requirements for the first time or who have are seeing them again, are there aspects that raise red flags of concern for you that, gee, I don't know if our pharmacy is going to be able to participate? Or are there areas that you feel like, yep, you're on the right track, glad to see this is moving in the right direction. We're interested in sort of doing a little bit of a gut check on where we're at with
with this.
Sarah, this is Rebecca Bryan from Gunderson. I have a question. I may have missed it in the presentation. Is it a requirement that the pharmacies have barcode scanning capabilities throughout the process?
It's not required to have barcode scanning. It's just there's a requirement to utilize technology to improve your dispensing process, but no specifics about barcode scanners.
Okay, thank you.
That was a great example.
Hey, Sarah and Erica, this is Prati. Hello?
Yep. Oh, hi.
Hi, Prati.
Hi. I just had a quick question. Lauren and I were chatting about this and wondered about the 1,000 prescriptions that need to be checked for the validation. And I can understand the thought process of taking what's going on in inpatient and applying that to the outpatient world or retail world. However, 1,000 doses to check in the inpatient or hospital world isn't quite equivalent to 1,000 prescriptions to check. I mean, it'll probably take us a longer period of time to get those 1,000 checks done.
Yeah. Yeah, we definitely hear you on that. We agree. We have an opportunity to do a little bit of further dialogue with a couple of PEB members offline, but from we've pushed on that before, and sort of where we've landed. The inpatient requirement, although given you're comparing prescriptions to doses and it's apples to oranges, I agree. The inpatient number is like 2,500, I believe.
Oh, okay.
So in their mind, they've come down a lot, but you know, as you said, it is different.
Yeah, you know, like in the inpatient world, I guess that also varies depending on size of hospital. I'm just trying to think of like time period that someone's sort of in a validation mode versus now they've been validated. Because I'm thinking for at least the couple sites that we're looking at, it's probably going to take a good month or even up to 6 weeks for them to be post-validation mode.
Yeah.
I'm curious what it is. Well, again, it's probably a moot point, and especially for this pilot, it's probably just something we need to accept, or I need to accept at least.
Yeah, I don't know. I don't know if anybody else on the call can comment on how long the inpatient validation takes. There was back when the variances were being done. So the standard sort of number has been 2,500 doses for inpatient, but they did make an exception for critical access hospitals and lowered the dose down to 1,500, knowing that otherwise the validation process, as you said, would be prohibitively long. And I think I'm gathering, Joe, when you asked the question about could you do validation at a busier site, that's sort of what you were getting at too, is to try and shorten the validation time frame. So we can do further assessment of that, but I'm not very optimistic that we'll get that adjusted.
I'm okay with it now, kind of just understanding the background and also it is less doses or less checks. I just think, yeah. Thanks a lot for that.
Yeah, this is Joe with UW Health. I want to say that when we do it on the inpatient side, based on what I recall, which is a few years back now, it probably takes about a week or maybe a few more days than that to fully validate a technician. So I think that probably aligns with the language that we're seeing here. I mean, I think it's just that balance of, like if we're going to insert technicians in this advanced role, I think like when I'm thinking of one of our sites that maybe does 100 to 120 a day, granted all of those aren't going to be eligible for tech check tech, you know, having them do it over a 2-week period or maybe a 3-week period seems reasonable to ensure that like we're not introducing any potential harm for patients. So I can see that point of it, and when I've been in discussions with some of the PEB members about crafting the language of these pilots, I'd say that's the similar approach. Is their goal is to ensure that we're not going to put patients at harm if we do these types of programs or pilots, and that's kind of how they've stood. Is we want to make sure that if we do have technicians doing that there's some qualifications at baseline, and also just making sure that they have the training, they've gone through the repetitions that a pharmacist has gone through, and pharmacists do this hundreds of times a day and have done it multiple times throughout their lifetime, whereas technicians maybe haven't really done this before, so the repetitions needed to get them there. So I think that's been kind of the rationale from the PEB when I've been part of discussions with them.
Thanks, Joe. That helps a lot, and I agree wholeheartedly with that. Especially for a pilot, I understand we need to be very mindful, and ultimately from the PEB standpoint, it's all about protecting the public, which is also part of what we're looking for. So thank you.
There was a question that came through typed in about utilizing medications that go out for delivery as prescriptions that could count towards that 1,000 prescriptions checked. And Erica and I are sort of processing that, but I think it would be sort of a similar thought process to what, Joe, you were asking about, is whether or not there could be volume gotten from another location. In this case, it would be volume gotten from other prescriptions. So we could make sure that the validation criteria is written in such a way that, you're basically doing product double checks, essentially. So the delivery isn't really going out without a pharmacist doing the product check in the validation period. So it makes sense to us, I think, to allow the delivered medications to be part of the validation piece, just not part of the actual tech going live piece. And that delivery piece was important to the pharmacy examining board members because you're not having that face-to-face interaction with the recipient of the prescription. So we'll clarify that and write that a little more clearly, or make sure that the proposal allows for that, and then sites can determine if they want to use that quantity for validation. So other feedback, other comments, questions, questions about next steps?
Sarah and Erica, how confident do you guys feel that the PEB is going to be approving the program at the September 22nd meeting?
Well, I will go out on a limb, and I'm knocking on some wood right now, and say that I'm super confident that it's going to be approved.
Okay, that's good. That's kind of where I thought. I knew that a lot of behind-the-scenes work had been done, so I was thinking that would be the answer, but I thought I'd just clarify.
Yeah, what we're trying to avoid, and what I think there's still a small possibility of occurring, is for some slight tweaks to occur to the proposal. So that's why I'm just a little bit leery of telling everybody to go full bore and implementing it as written right now. But I really feel confident that we're going to get an approval on the 22nd.
Excellent.
I think there was one other comment too. Is somebody else had a comment? Well, to give time for any other comments that people want to raise, I would say next steps, Erica, you kind of outlined on the slides. We've got the meeting to have on people's calendars for October 26th, so be sure that you have that on your calendar. We'll send some further feedback or further communication out about who you may want to have at that meeting so that you have the right folks there. And then, as Erica outlined, by October 14th, we'd like to have a really good sense of what sites you would like to include. So we've communicated with you about the number of sites that we're looking for, no more than 2 from a given organization, and that We'd like to also start laying the groundwork for Erica to do some site visits, to do some in-person dialogue and discussion with the sites, for you to be a part of that, and to have us help you as much as possible. That's really what we'd like to leverage the resources from the NACDS grant to do, is really help streamline this as much as possible as you move into the implementation phase. So that's what we're looking for as next steps. We'd certainly like for you to be in communication with us about what's going on in terms of your thought process for timeline. So I've had a couple of offline discussions with folks about implementing new software or staffing changes, et cetera, that may impact your implementation timeline. So if you could keep us abreast of what you're thinking as it relates to that. We're, as we said, really willing to work with you on it, but we just need to be kind of looped in on what your thinking is. Anything else you want to add, Erica, in terms of next steps?
I don't believe so. I think it's just, yeah, feel free to contact me with any more questions or comments. I'm going to, like I said, reach back out. We'll get some answers here to the questions, although we talked through most of them, and just continue sending you information here. But yeah, I'd like to come meet everybody, so if you have a few dates, it'd be great if you could send them so I can get them on the calendar here.
Any other last comments or questions? Well, Erica did record today's call, so we will make that available. So if you have key people that are within your organizations that weren't able to join us on the call, we can certainly make sure that they have access to the recorded version of this. You have the slides. There's one update to the slides that Erica can send out, maybe the final version right after this call. And then we'll keep you up to speed on what happens on the 22nd. Great. Well, thanks everyone.
Thank you.
Thanks, you guys.